Hello, it's Dr. Rhonda Johnson. Today's Thursday, October 5th, 2023, and today I'm talking about breast cancer awareness. Now, we all know that the month of October is Breast Cancer Awareness Month. So let's talk about breast cancer. What is it anyway? Well, breast cancer occurs like all cancer when the systems that control the creation, the growth, and the death of cells in the breast aren't working right, and cellular growth and reproduction gets out of control. Now, there are breast cancer types that grow slowly, and there are types that are aggressive. Now, remind you that the function of the female breast is to produce milk, and about 80% of breast cancers begin in the milk ducts of the breast. Now, breast cancer cells can migrate. They can travel from the breast to other parts of the body through the bloodstream and the lymph nodes. Usually they travel to the lymph nodes in the underarm first, but then if they spread, they typically go from the lymph nodes or the bloodstream to the bones, the lungs, the liver, or the brain. Now, breast cancer occurs in men, but is less common than in women. The lifetime risk of getting breast cancer in the United States is 1 in 8 for women and 1 in 833 for men. Now, many women, when they get a diagnosis of breast cancer, they want to know, will they survive? So the good news is that modern treatment has really improved survival for women with breast cancer. Now, it varies from person to person, but today more than 3.5 million breast cancer survivors live and are alive in the United States today. So what can you do to look for breast cancer? Well, look in the mirror, folks, and look for changes in your breast appearance, the size, the shape. Look for discoloration. Look for dimpling of the skin. If you feel a lump of any size, you want to follow up with your doctor. What if there's a rash or a different look to your breasts? You might have nipple discharge and you're not breastfeeding, or you might have pain in one particular area. Those are signs that you need to call your doctor. Now, remember, many women have breast cancer and they have absolutely no symptoms at all. But what to do if you find something unusual? Again, notify your doctor. Now, not everyone has a doctor. I understand that. Not everyone has health insurance. But talk to your friends, your family. Call every hospital in your town and ask them if they have a social worker that can help you with your situation, if they have a social work department, or call your local health department. Call your local medical society. The bottom line is just don't give up and think it's going to go away. You can also go online and type in breast care helpline or breast cancer helpline. Some breast cancer advocacy organizations offer helplines for women who don't have doctors or insurance. Now, what can you do to lower your risk of breast cancer? Again, you may not be able to prevent breast cancer, but there are some things that are just generally good health anyway and can lower your risk of breast cancer, and that's keeping your weight in check, because being overweight can increase the risk of many different cancers. Being physically active, eat your fruits and your vegetables, limit your alcohol intake. Folks, even low levels of drinking can increase the risk of breast cancer. Don't smoke. Breastfeeding, if possible. Avoid birth control pills after the age of 35. Ladies, if you're taking hormone therapy for menopause, you want to be on this for the shortest amount of time possible, and always have a conversation with your doctor about the risk and benefits of hormonal replacement therapy during menopause. Now, everyone should always know your family history, but it's important to know that some women have no positive family history. Other women have a strong family history of breast cancer, and they're on a path to lower or manage their risk. Now, I don't want to end without talking about mammograms. Mammograms screen for breast cancer. They don't prevent cancer, but they save lives because they can find cancer early when it's more treatable. Now, the recommendations say that women should get a yearly mammogram starting at age 40, but if you have a higher risk, your doctor may recommend screening earlier. So that is my message today during this October Breast Cancer Awareness Month. I hope it's been helpful. Take care, folks, and be well.